Dr. Joan St. John has been a general practitioner for many years. She's a GP with special interest in diabetes, although we're not talking about diabetes today.
We never know.
I know. Currently a GP, clinical lead in diabetes in the area of Northwest London. And she's also part of the Diabetes UK Professional Leadership Alumni. Dr. Joan St. John is one of the first Diabetes UK clinical champions, a programme that assists and equips healthcare professionals that are passionate about diabetes to improve an aspect of diabetes care in their area. Dr. Joan St. John specialises in primary care diabetes and is one of the co-authors of Carbs and Cows World Foods. And this is the book that provides a comprehensive and uniquely visual way to illustrate the carbohydrate content of traditional foods of Black, Asian, Arabic, and Caribbean communities. Dr. Joan works as part of the multidisciplinary award-winning Brent Integrated Diabetes Service, and her commitment to education has seen her giving talks and working in partnership with community and church groups, as well as teaching doctors and nurses and pharmacists and other allied healthcare professionals. Dr. Jones strives to provide excellent healthcare to all and has provided advice, practical assistance, support, and health information to organizations dealing with conditions that disproportionately affect Black people and other ethnic minority communities. For example, Sickle Cell Society, Culture Dementia, as well as Diabetes UK, and in the past, the ACLT, African Caribbean Leukemia Trust, and many other groups. So, with that said, I will now hand over to Dr. Joan St. John.
Thank you very much, and thank you very much for inviting me to speak today in this afternoon's event. So my name is Dr. Joan St. John. I'm going to try and share my screen. Bear with me a second. And what I'd like you to do, please, is, there we go. I'd like it to be as interactive as possible. I think it's always a two-way learning process. It's not just about one person talking, it's about us learning together. So what I'd like you to do, if you can, please, is you can shine your camera. If you take your phone out and shine the camera against the QR code, which is the black and white bits, it should take you to this Mentimeter, and so that will enable you to answer some questions that I'm going to pose as we go through the presentation. So I'll give you just a few minutes to do that, and then we'll get started. So if I can ask my co-host to just give me a signal when they think everybody might have done that. So with your phone, put it on camera, shine it at the screen, and it should take you to this poll. Have you been able to do that?
Has everybody done it?
I think so.
Yeah?
Yes, yes. Has everyone done it?
Okay, so
Yeah.
let's give it a go. By the way, I can't see the chat, so I'll have to rely on my co-host to help me with that. So today, really what we're going to talk about is what is dementia, of course. Now, the talk was titled Alzheimer's, but I will explain why we need to be a bit more specific in some ways about the terms that we use. So the where, why, what, when, how about dementia. We'll talk about diagnosis, risk factors, and of course prevention, because I try never to talk about a subject without talking about what you can do about it. It's always got to be a positive message. And then of course we're going to have the Q&A as well. So given that we've got 25 minutes or thereabouts, and I'm going to try my best not to go over, we can't talk about every single aspect, but I hope what I'll be able to do today is to highlight some important things for you to be more aware of this condition, and also to be able to recognize it perhaps better, and to know what you can do for yourself and for your loved ones to perhaps try to avoid it. So what is dementia? And I'm using that term dementia rather than Alzheimer's, because dementia is not a disease. I think people sometimes think it's a disease. It's not a disease, it's what we call a syndrome. And a syndrome is made up of different symptoms and signs. So it's not a disease as such, it's a syndrome where the function of the brain is declining, and you get a deterioration in certain things that we all would recognize. So you get a deterioration in things like people's memory, people's thinking, perhaps sometimes people's behavior, and sometimes a person's ability to perform everyday tasks. And as we know, it varies. So no two people who have this syndrome will be the same, because if we're talking about the brain, everybody's brain is slightly different, because that's the way, one of the ways in which we can express our personality. And if you think about it, we're all individuals. So it's not the same, it's not going to be the same. Dementia is not going to be the same in each and every person who has this condition. It's going to express itself slightly differently, but there will be common themes. So now, hopefully, if this works, we should get some questions. I'm going to pose a question to you. First of all, how many people are living with dementia in the UK currently? So we've got 500,000, we've got 750,000 people, or we've got 900,000 people. So, okay, great. It's working, fantastic. So we've got more people saying 750,000, less people saying 900,000. That looks as though everybody who wants to answer has answered. So I'm going to close the voting, and the answer is, let me see if it goes on here. Oh, okay, let me go back. It's 900,000. Okay, so to the 40% of people attending today who said 900,000, you are correct. It's 900,000 living with dementia at the moment. Now, what I would say to you is that's not 900,000 spread evenly throughout the population of the UK. Most people will be over the age of 65. Because we'll find out later when I talk about it, about the risk factors, age is one of the biggest risk factors for developing dementia. So it's 900,000 people in the UK currently. So let's talk about the terms, because as I said to you, dementia is not all Alzheimer's, okay? Alzheimer's is a form of dementia, and that's the important thing I think I'd like everybody to be aware of from this talk. Dementia is an umbrella term, so it's a term that we use to describe those range of symptoms that I described before, things like the memory changes, the behavior changes, the loss of brain functioning. So dementia is the umbrella term, and underneath that umbrella, you've got different types of dementia. So Alzheimer's makes up the vast majority. So it's somewhere between 50 to 75% of people who have dementia will have Alzheimer's disease. Yeah. But there are also other types of dementia. I'm going to concentrate mainly today, given our limited time, on the two main types. So Alzheimer's disease, which is the main one, but also vascular dementia. So those two will account for about 75%, or even up to about 80% of all types of dementia. But you could also get Lewy bodies dementia and frontotemporal dementia as well, but they are much less common And so for the purposes of today, I'm going to concentrate on Alzheimer's disease and also vascular dementia as well. So important thing, dementia is the umbrella term. Alzheimer's is a form of dementia, but not all dementia is Alzheimer's. So let's talk about Alzheimer's disease. So the brain is damaged by things called plaques and tangles. And, you know, there is lots of emerging evidence. We don't know everything about dementia or Alzheimer's disease, but these two proteins, these two amyloid proteins seem to be very important in the development of these plaques and tangles, which causes the deterioration in the brain function in Alzheimer's disease. In addition to that, you also get a reduction of this chemical in the brain, this chemical messenger called acetylcholine. And that chemical messenger takes information from one part of the brain to another. It's the transmitter that transfers information from the brain cells, the neurons. And if you don't have enough of this acetylcholine, then you don't have that information being transmitted effectively. And so you don't have that information being transmitted effectively, and that causes the loss of function. So Alzheimer's disease is due to these tangles and plaques, due to these proteins forming, but also a reduction in chemical messages. And for most people, there's a gradual decline in function over a period of time. The way that you would recognize that somebody might be experiencing Alzheimer's disease is that they've got the problems with the memory, common to all forms of dementia. But it may be, in particular, recalling recent events. So I don't know if people have seen the advert on the television at the moment, where the lady constantly asks her partner, her husband, what time are we leaving tomorrow? And she repeatedly asks him the same question. And he begins to realize that there may be an issue with her memory because she repeatedly asked him this question. So that may be one of the ways that you may notice in a loved one that there is a problem with their memory. The other way you might notice, or the person may notice themselves, is that they've got difficulty learning new information. Now, I think it's the case for a lot of us that as you get older, it's harder to learn new information. And what I do later on in the talk is give you some examples of how you might know whether it's part of the aging process. I think somebody's not on mute.
Can you, whoever is speaking, can you mute yourself, please?
Yeah.
Thank you.
So whether it's part of the normal aging process or whether it's this condition, it is an illness, whether it's this condition of Alzheimer's disease. So as I said earlier, it mainly affects people over the age of 65. But after that age, the risk of developing this condition doubles every 5 years. So if we're talking about people who are over the age of 80, then 1 in 6 people may develop dementia. And remember, I said the greatest proportion of dementias is Alzheimer's disease. Over the age of 90, you're talking about 1 in 3 people. So remember, that's not everybody, yeah? Because it's only 30-odd%, 30 to 40%. That means 60 to 70% of people will not develop it even over the age of 90. Remember, the second most common type of dementia is vascular dementia. And what are we talking about with that? So we're talking about a type of dementia which is caused by problems in the blood vessels. The blood vessels are like the sort of road network or motorway network that carries blood all around your body. So that's from the top of your head to the tip of your toes. It goes every single part of your body, okay? If you've got problems with those blood vessels, then you can develop what we call a vascular dementia. And I'll talk about it a little bit more later, but you can imagine that certain things like a stroke, where the big blood vessels to your brain are affected, that you could get a type of vascular dementia after you've had a major onslaught to your blood vessels. It's different to the Alzheimer's disease type of dementia, because with vascular dementia, there tends to be a stepwise increase in those symptoms. And remember I said with Alzheimer's that it tends to be gradual. Well, with vascular dementia, it takes more of a stepwise. So people can be okay for a while, and then there's an increase in their memory loss or the difficulties that they have as a consequence of the dementia. So it depends which part of the brain has been affected. So it might be things like language or writing or communication, or it might be the memory issues that are the main problem. Different parts of our brain do different things. So depending on which part of the brain is affected by a stroke, it can then determine what's the major symptom that somebody can experience. So as I said previously, it's the second most common form of dementia in the over 65s. And you can get it in the under 65s, but it's not very common to get it in the under 65s. So this umbrella term of dementia, in which we have the Alzheimer's disease and we have things like vascular dementia as well as the others, what are the common symptoms that you can get for all types of dementia? So remember I said each person is an individual and may express these in an individual way, but common symptoms are things like memory loss, problems with reasoning or communication, changes in personality, which may be not very obvious as dementia when it first starts, but gradually as other symptoms come in, you may then realize that the person actually has dementia along with this change in personality. And people can sometimes have a difficulty carrying out certain activities that they used to do. I found that quite often, if someone does a certain thing for their profession and they've done that for very many years, that skill can actually be one of the last things that go with some people, and it can be the first thing that goes with other people. So as I say, it can express itself very, very differently. And I'm sure people would know that some people who have dementia have wandering, restlessness, sometimes eating problems that can take the form of swallowing problems or loss of appetite, incontinence difficulties, hallucinations, mobility difficulties, and obviously with this conglomeration of symptoms, people become increasingly dependent on others for assistance. So I can't do anything without mentioning diabetes. So here comes the diabetes bit. So as I said, you know, in vascular dementia, it is about the blood vessels. Diabetes can also affect the blood vessels. And this diagram illustrates different complications that you can get as a result of diabetes. And you'll notice at the top, there's something called cognitive impairment, which is a difficulty with thinking, reasoning, those sorts of brain functions. Cerebrovascular disease is things like the stroke. So that you can see that diabetes is one of the conditions that could possibly cause vascular dementia. And there are some studies to support this. So there is an increased risk. There seems to be some interaction between diabetes and dementia. So there's an increased risk if you are living with diabetes of developing dementia. And it tends to be people who've been living with diabetes for longer, or they began having this at an earlier age. They seem to have the increased risk. And there's an increased risk of developing Alzheimer's disease in people who are living with type 2 diabetes as well. And conversely, people with Alzheimer's have an increased risk of developing diabetes. Have an increased risk of developing diabetes, and also the what we call the impairment of glucose tolerance, so difficulty controlling their glucose level without getting to the level whereby we would classify it as diabetes. So sometimes this is called type 3 diabetes, but I think that to me, it's a confusing term. So just to say that there is an interaction between diabetes and dementia, and it's likely to be a vascular type of dementia that there is the interaction with, as well as the Alzheimer's. So again, if you go to the poll now, I want to ask you, I've given an example of one condition that might cause difficulties with memory problems, because I've said what dementia is. How would we recognize in ourselves and somebody, a loved one perhaps, that somebody might be suffering with dementia? So what other conditions, and for this one, I'm not giving you examples. What I'm asking you to do is to put a word or two of the things that you think might cause memory problems. Okay, so not dementia, but other things that could cause memory problems. So you type a word in and it should come up on the screen. So if you can think of any other conditions that might cause memory problems, age, as I said previously, it's the biggest factor in terms of your risk for developing dementia. But as we get older, it is certainly more difficult to learn new things, and so that would cause difficulty with memory problems. Hereditary is a very interesting one, and I'm going to say a bit about that. Do we have any other things stress? Okay, so stress is one of the things I'm going to mention. What else do you think might be could cause memory problems and actually have nothing to do with dementia? So stress is coming out loud and strong. Addictions, yeah, because anything that damages your brain, that could potentially cause you to have memory problems, because it's going to affect your function. Poverty, yep, it can do, for a variety of reasons. It can certainly affect how your brain functions. And if you're affecting how your brain functions, that's going to have an effect on your memory. Okay, so, and loneliness, love it. Thank you so much for the person who's put that in. Absolutely. Menopause, yeah, completely. So the hormones can affect the way we function, can affect our memory. I'll give you just, because I'm mindful of the time. Okay. And not keeping active, thank you. And bereavement, absolutely. And unfortunately, alcohol, completely. Unfortunately, too many of us have suffered bereavements over this pandemic. And we know that that can affect the way we function generally. And, you know, our general health is tied in very much to how we perform. And so therefore our memory is definitely affected by that. Thank you very much for that. So how would we diagnose it? So this is from healthcare professionals' point of view, from you recognizing perhaps some worrying or concerning signs in a family member or a loved one. So the first thing to say, there's no one specific test. Remember, it's not a disease as such, it's a syndrome. So it's a conglomeration of various symptoms and signs. So we base the diagnosis on certain symptoms, observations, signs. You might have something called a mini mental state examination, which involves various tests that you would do. But what I found particularly helpful, if I was sitting on the side of the desk as a healthcare professional, is to have somebody come with that person who's concerned about their memory, and they could give me their objective assessment of that person's functioning. So as an individual, you may not recognize all the signs and symptoms yourself, but an external person, a loved one, may be able to help us with that. It's really important to exclude other conditions, and we've named some of the conditions there: stress, bereavement, other things that might affect your memory and actually mean that there's nothing like dementia going on. And when there is a concern, either through the tests that you have with your healthcare professional or something that you recognize in yourself, then it might involve a referral to a memory service. So it's really important, if you are concerned, that you do seek help from a healthcare professional to get an assessment made. It's really useful if you take a loved one along with you to provide some supporting evidence. And then it may be that you'll have further tests which may involve referral to the memory service. So we mentioned some of these because these are the things that we need to exclude to be sure that there is a diagnosis of dementia, rather than it being something like stress. Because all of us know what stress feels like. And if you're overwhelmed by stress, it's very hard to focus. It's very hard to think clearly. It's very hard to process new information. And so therefore, how is your memory going to function? It's not going to function very well because it's just overwhelmed with these stressful thoughts. Sleep is a really important aspect of your general health. And you know that if you're overtired, sometimes if you've been up all night, you don't function very well that following day. And if your brain's not processing information properly, it's going to affect your memory. We mentioned addictions and alcohol. So you can actually get a specific syndrome associated with alcohol, but alcohol can cloud your general thinking and brain functioning. So that's not going to help you in terms of memory. I mentioned side effects here, and side effects are not only coming from medication. I want you to think about sometimes side effects can be from conditions, and I'm going to mention some of those conditions on the next slide. But certain medications can affect things like your brain function, because you may realize that if you take certain medications, it says, do not take while operating machinery or driving. It always seems to say those two things. Now, if something affects your ability to operate machinery or driving can be quite a complex thing. So it can, in the long term, affect your memory. Now, what I don't want you to do is to immediately stop taking any medication that you're taking because you think that might be affecting your memory. What I would like you to do, if you do think that that was happening, is to please go and speak to your healthcare professional, the person who prescribed it for you. It's always important to discuss that and communicate with them. So I said about side effects. Side effects of medication is one aspect, but sometimes you can say side effects of a condition or complications of a condition or effects of a condition. And what conditions might those be? We mentioned stress. And along with that, I think we also have to talk about things like depression and anxiety. Those mental ill health conditions can affect the way your brain functions. If you're feeling low in mood, if you don't have any energy, if you're feeling down, that can obviously affect the way your brain functions. And conversely, if you're feeling very anxious, if you're feeling very restless, uneasy, that can affect the way your brain functions. And these things can then obviously affect your memory. Severe infections, thyroid problems, when you can, with an underactive thyroid, get a slowing of your mental processes. We mentioned the menopause. Certain vitamin deficiencies can do this as well. So if you're lacking in things like vitamin B12, and you may know that a severe head injury can affect your memory. I think this has come to the fore with our increasing knowledge of the effects on footballers and rugby players of brain injuries. And sometimes it's an actual brain injury, but sometimes it's almost like a sort of low-grade trauma from the sport, either heading the ball or whatever, that they think may be associated with memory loss. But again, these are things that we're learning more about. So you might ask yourself, remember we said age is one of the most common risk factors for dementia. So do you know if this is age, or do you know if this is dementia? Well, it can be difficult, but sometimes if you forget somebody's name or you forget an appointment, but you're able to remember it later, then that's more likely to be something associated with age. rather than dementia, where you forget somebody that you know very well, or you're forgetting recent events like we discussed on that advert that's on the television. Sometimes having trouble finding the right word doesn't mean that you've got dementia. But if you're frequently having that problem, or if it's getting more frequent, or you have to say that thing, that can sometimes be a suggestion. But these are not absolutes, okay? These are not absolute. So for each person, it's going to be slightly different. So I don't want you to think the next time you can't think of the word that you want to use, that you're developing dementia. It's a whole constellation of signs and symptoms. Certain things may trigger in you. If you were a world-renowned pianist and all of a sudden you couldn't play the piano, now that would be obviously something that you'd be concerned about. But there are lots and lots of different symptoms that might be part of the aging process as opposed to dementia. I think in the interest of time, I've got lots of examples of that, but I'm not going to go through those. We all forget sometimes where we put our keys. And what I used to say is, if you forget where you put your keys, that doesn't mean that you're developing dementia. But if you forget what the keys are for, what you do with keys, then that is obviously a more worrying sign. So I'm going to whiz through these. Decision making. So somebody who used to look after the family finances, who's not able to do that anymore, who has to hand that over, then that is a more worrying sign. We talked about difficulty learning things, getting lost sometimes. I have never had this happen to me, but I know some people do. Park the car somewhere, go to the car park, can't remember where they parked the car. Doesn't mean that you're developing dementia. But if you go to a shop that you normally go to, or you're trying to go to a shop that you normally go to, and you cannot remember the way to get to that shop, that might be a more concerning sign. And changes in behavior, certainly. So somebody's change of personality. Remember I said that could be the first sign. Also somebody accusing people of taking their money, hiding their possessions, things like that. And you may think, well, where has that come from? That change in behavior, change in personality can sometimes be the first sign, but it can be something that comes on very much later in the condition. I had questions here, but we'll probably take questions at the end. So I've talked about dementia. I've talked about the two main types, but what I really want to concentrate on, and awareness, how you would recognize it perhaps. But now what I'd like to concentrate on is the risk factors for it and what you can do to reduce your risk, if you can. So I'm asking, can you do anything to reduce your risk of developing dementia or not? What do you think?
Yes.
Okay, so somebody said it's part of getting old. Some people are saying you can reduce your risk. Some people are not committing. Okay. So in terms of the jury, the representative sample, it seems that people do think you can reduce your risk. So let's see. Yep, more in favor of reducing your risk. So let's see, because there's somebody who thinks it's just part of getting old. But remember I said over the age of 90, it's about a third of people who can have dementia. So that means 2/3 may not. So what are the risk factors? So if we talk about Alzheimer's disease, okay, Alzheimer's disease being the most common type of dementia, but not the only type, and not, you can't say that Alzheimer's equals dementia, okay? What I mean by that is there's other types. The biggest risk factor, as we said previously, is age, but there are significant other risk factors as well. So clinical depression, so not feeling a bit low, but actual clinical depression is one of the major risk factors for subsequently developing Alzheimer's disease. Diabetes, so as I said to you, can't do a talk without mentioning diabetes. Now, this may surprise you, having a high body mass index, so having high weight compared to your height, and low educational attainment. So that's in terms of your schooling and education, and smoking. Smoking is just a no-no, just don't do it is my advice. So these are the things that can increase your risk of developing Alzheimer's disease. Now, in the word cloud that we did, and when I asked about risk factors, somebody put up hereditary. Actually, we'd be surprised to know that the hereditary types of dementia, so dementia we're talking about now, that umbrella term, is very small. So most types of dementia are not the hereditary type. When I say hereditary, I mean in terms of genes. So if your family members have the particular genes, that you have a risk of developing dementia. So that type of dementia is actually a very small risk. And a lot of people are very concerned that if a family member has dementia, they may get it. Now, there may be an association between the type of dementia that the person has and the risk factors that you as a family member have. But if we're talking about a genetic risk, it is actually a very small risk. So it's very rare for people to have these familial genes. What you tend to notice is people will develop dementia at a very young age. And if one parent has these familial genes, then their child has a 1 in 2 chance of inheriting that gene and developing dementia, and usually in their 50s and 60s. And remember what I said to you previously, most dementia develops over the age of 65. So there you can see there's a difference there already. There are also some what we call risk genes. So there are different types of genes that have been recognized to increase your risk. So these are not the familiar ones where you get a definitive risk. These risk genes increase your chances of going on to develop dementia. They do not mean that you will absolutely get dementia, but they do increase your risk. But overall, the genetic risk for developing dementia is small. So I just want to make that point very clearly to you. But 1 in 3 cases of dementia could be prevented if you address these lifestyle factors. So here is our signal to what we could do to try to reduce our individual risks of developing dementia. So things like increasing your learning. So I'm not sending everybody back to school, but what I'm saying is the more you can keep learning, the better it's likely to be for your brain health. Physical activity, and I think that was one of the things that came up in the word cloud, lack of physical activity, people said, is likely to increase your risk of dementia. So physical activity, keeping active. And if anybody was up at 5:45 this morning listening to Radio 4, they might have heard Dr. Michael Mosley talking about things that you can do to improve your health. And the one that he focused on today was dancing. And dancing is a form of physical activity, 5 or 10 minutes. And this particular physical activity being shown to increase 2 main areas of your brain and your brain health. So put on your favorite track, pick a nice partner or somebody else in the house and do 5 or 10 minutes dancing, okay, from today. is something that's actually going to help your brain health. And on that word cloud, we had loneliness. Absolutely. Loneliness. And, you know, this is something, unfortunately, I've seen in family members, extended family, that the pandemic caused so much loneliness for people. It really can increase people's risk of poor brain health, is what I'm going to call it, therefore leading on to things like dementia. So social contact is really important. Now, we had to self-isolate because of the pandemic, but now gradually, safely, I would like to encourage social contact safely when you possibly can. Get outside, because the other thing that helps is nature. So being outside in nature is something that can help. So prevent things like hearing loss. If you're having problems with your hearing, it's important to get that sorted. High blood pressure, obesity, smoking, all those sorts of lifestyle factors are really ways that you can reduce your risk as an individual. I really like this slide because it shows, I hope that it's transmitting properly, but it shows at different times of your life what you could be doing to improve your brain health, is what I'm calling it today, okay? Reduce your risk of developing dementia. And this is for you as an individual, okay? Because when they've done population studies, they found that if you do these things, you can reduce your risk for the population. So in early years, it's all about education, education, education. Remember, the learning, really important. In midlife, and you can define midlife however you want to define midlife. I think the older we get, the older midlife becomes, but anyway. So midlife, avoiding things like head injuries, traumatic brain injuries, high blood pressure, drinking to excess, and obesity. So avoiding being overweight. Overweight is not good for your general health, but it's also not good for your brain health. Later life, smoking, depression, social isolation, physical inactivity, air pollution is actually coming up as well, and diabetes. And so there's about a 40% reduction of risk or risk factors that we know about throughout your life. 60% we don't know about, okay? So those are factors that we don't yet know about. But this can make a significant reduction to your risk throughout your life. So whether you're midlife, whether you're later life, there are definitely things that you can do. So the answer to that poll was there are definitely things that you can do. Remember I said, you know, pick a nice partner and do some dancing around your kitchen. You might want to go out for a walk. As I said, nature helps, but you know, you can always do some housework if that's what you really fancy doing. Hoovering, swimming, dusting, anything that gets your heart rate going. So if you're not able to go outside, there's still things that you can do. There's still types of exercise that you can do. Healthy eating is going to help because it's going to help to produce less of those additional conditions. I just realized the time, so I'm going to whiz through this. I think that's actually, yeah, I always want to show you Grenada and St. George's, but I'll leave that on here and take your questions. So I hope that's helped. Alzheimer's is a form of dementia. It's not the only type, there's different types. Age is one of the most common risk factors, but there's lots of things that you can do to reduce your risk. And I hope I've given you some signals how you might recognize it in yourself, or you might recognize it in others. The thing to do is to try and recognize it and be aware of it as early as possible so you can do something about it. We're really blessed to have a solicitor going to talk about power of attorney. So one of the things, if you are aware of your risk or some early problems with your memory, you need to put things in place so that you have somebody who will speak on your behalf if you're not able to do that. But we'll find out so much more about that with the next talk. So thank you very much for your kind attention and your interaction, and I'll leave it there and take questions.
Thank you, Dr. Joan St. John, for your wonderful presentation. We'll now take, as Dr. Joan has mentioned, we'll now take some questions. One of the things I should have mentioned that during the time that Dr. Joan was presenting, questions could have been posed in the chat, but some of the questions I understand have been answered by Dr. Joan St. John. But anyway, your questions, please.
I've stunned everybody into silence.
Well,
Hello. Hello.
hello.
It's Michael here.
Hey, Michael.
Hi, good evening. A
Hi.
great presentation, Dr. St. John.
Thank you.
One of your examples was to avoid depression. What ideas would you give to avoid depression?
I think part of the ideas that I gave earlier on, you know, when I say about physical activity is not just about improving your physical health, it's about improving your mental well-being as well. And it releases, we know, those feel-good hormones. But in terms of if you are physically fit, you tend to be mentally fitter as well. So certainly physical exercise, I think, is so important. When I say that, I don't mean going to the gym. I mean, you know, going for a walk, getting out into some green spaces, do some gardening actually is one of the things that can really help. And sleep, I think, is the other really, really important thing that is sometimes missed. We never take it seriously enough, I think. And, you know, I think as time goes on, we'll realize how important it is in helping our general health. We know to a certain extent how it can physically affect us, but I don't think we really recognize fully how it can mentally affect us. So those are two key areas, and eating well is the third thing I would say. Talking with loved ones, if you have somebody that you can talk to, so not avoiding social isolation. We human beings are social animals, so I think those are the things that I would advise.
Questions asked.
Thank you very much.
Thank you.
A question is asked from DM Bowen. Why is it that high body weight can lead to mental issues, dementia?
So it's an association, it's not an absolute, but it's likely that there are factors which arise from being, can I say, overweight or obese, which damage our blood vessels, damage the functioning of our bodies, and that can lead to conditions like dementia. So it's not, if you're overweight or obese, you will definitely get dementia. It's not that, but there is an association between people who are obese or overweight going on to develop dementia. And as I say, there are multiple factors which affect the functioning of our body, affect our body's hormones, affect our body's physiology, affect our body's something called oxidative stress. So it essentially affects the way our bodies function and doesn't help, it's not conducive to good health.
Another question, do multivitamins help to prevent diabetes?
Diabetes or dementia?
Or sorry, do they help to prevent memory loss, such as omega-3 and supplements like that?
So I think a good diet, you know, there's this slogan called food first. Let food be your medicine is one of the things that I would advise. So remember I was saying about good quality diet. So try to get your omega-3 from oily fish. If you can't eat oily fish, if it wasn't available, if you couldn't eat fresh vegetables and fresh fruit, then yes, take multivitamins. But if you have a balanced, high quality diet, and by that I mean not an expensive diet, I mean a healthy diet, then you should be getting those minerals and vitamins through the food.
A question here says, I don't know if it's how relevant it is, but it says, what advice have you got for carers or family members who are shut in, unable to get out and about?
I think that's hugely difficult. And I think I have to salute carers. I'm a carer myself, and it can be really, really difficult. So I think you have to connect in whichever way you can connect. I think you have to be aware of yourself and your needs, because if you're not aware of yourself and your needs, and you go under, how are you going to care for the person that you need to care for? So do what you need to keep yourself healthy. We've talked about diet, we've talked about doing some form of exercise. And remember I said, you know, you can dance around your kitchen if you need to. So to find that 5 or 10 minutes, put on some music that makes you feel good, maybe reminds you of previous times, and you know, have a little bit of a dance in your room. You can do that as a carer not able to get out. If you can get out, then I would suggest things like going out for a walk. If you can do that with friends, if you can have some time with friends. So if you have somebody who can give you a bit of respite, whether that's once a week, whether that's less often than that, it's really important that if you can enlist somebody else's help to protect your own health, that you do that. It's incredibly difficult because carers are providing the majority of unpaid care for people who are living with not just dementia, lots of other conditions. So, you know, it is a stress on them, and they need to definitely look after their own health as well.
I know time is a factor here, but there are just a couple of more quick questions.
Yes.
Is there any medication that can slow down dementia? And the other question is, what about your thoughts on Caribbean dishes like jerk, curry goat, etc.?
I like them.
Can these present risk factors for dementia?
Prevent risk factors, did you say?
Yeah,
The
can
food?
these present risk factors? Yeah.
Okay, all right.
Are they a cause?
No. So can I answer that one first? No, they're not a cause. No, absolutely. You know, I'm always championing our food. There's nothing wrong with our food. It's nutritionally complete. Sometimes it's the way it's cooked that is not the healthiest way. However, there is nothing wrong with our food, and no, it doesn't present a risk factor for developing dementia. Yes, there are medications that can slow the progression. Remember I said with Alzheimer's, it's that gradual, slow progression of brain function. And if you catch it early, what you can do is sort of plateau things so that it takes a longer time to decline. So in that way, people have better brain function for longer. But it is, yes, so there are medications that can be taken, but it's best obviously to make that diagnosis as early as possible, so then you can access those medications.
Right, sorry to interrupt. I have three quick questions I'd like to ask before we...
Is that going to be okay for the other speakers?
Yes.
Okay, all right.
Very quick. One question, first question, should you tell an Alzheimer's patient the truth, or Alzheimer's sufferer the truth?
I say everybody is, I'm going to be really quick, everybody's an individual, and I think as a loved one you make that decision. I think wherever possible truth is best. Yeah. Right. But for an individual, you may recognize that that's not going to help them, and they may get depressed, and that's not actually going to help them, their mental condition.
Okay. Second quick question. Is Alzheimer's more prevalent in males or females?
More prevalent in females because females tend to live longer.
Yeah. One final question. Why is it so common these days?
I wouldn't say it's necessarily more common these days. I think it is certainly more recognized these days because we're trying to recognize it because we have medications that can help to treat it. In addition, you might say that it's more common because we have more of these vascular conditions. So there's more things like diabetes and so on. But we can't definitely say that because we didn't have all the ways that we can recognize it previously. So we're not comparing like with like.
Thank you very much for answering those questions. Thank you.
Okay.
An excellent presentation, definitely.
Thank you.
Thank you, Dr. St. John. Okay, thank you.
Thank you.